Hi, this is Dr. Froy. Today what I want to go over with you is some of the ideas of mental health and why we have reached out and we have been able to help a lot of people with depression, anxiety, and bipolar type symptoms. And there's a few concepts that you need to understand is that we're not here to treat depression, anxiety, and bipolar. I just had a good friend of mine ask me a question, said, hey, what do you do for anxiety? We're not here to treat the medical diagnosis. We're here to lift up the hood, see what's not functioning properly, and correct what's not functioning properly inside of that person. We also have to stop naming these diseases as if they're all psychologically based, because that is a dead-end tunnel that doesn't bring people down the road of looking at what may not be functioning. And I just want to kind of go through some of the manuals here. So the DSM manuals, first manual is 1952. A lot of these diagnoses came from men that were in war, and they were trying to get them back onto the lines. And so they formed the book, and within a short time frame, it then started to go out to the public. The DSM-2 comes out in 1968, more names. Again, a lot of these are theories as to why the person is behaving that way, why you're feeling that way. But in 1952 and 1968, we're still talking about psychological causes mainly for what's going on here. Freud, Jung, that kind of stuff, highly influenced a lot of what was going on here. Then in 1987, the DSM-3 comes out, and the difference between 1968 and 1987 was in 1965 a theory comes out that there's a chemical imbalance inside the brain, and in 1987 this entire book now is all based on chemical imbalance inside the brain. So you may go into someone and say, hey, why do I have anxiety? They're going to ask you two questions. Anybody in your family have it? On your mother's side, your father's side, you say yes, it's cause and effect. There must be some genetic glitch. There's a chemical imbalance inside of your brain creating the anxiety that you may be having, and over a time frame, then we give you the drug to correct the chemical imbalance. Now it's a pretty simple idea. The only problem is that none of it is based on science. So when I evaluate someone, we go very deep into looking at what's not functioning well. Past DSM-3, we had DSM-4 come out in 1994, and then a DSM-5, the latest book, in 2013. And what you want to know about this is, you see the books, they get thicker and thicker and thicker. A lot of these diagnoses come specifically from people raising their hand and saying, yes, we believe that's a new mental health. There's no scientific basis for a lot of these, and that's the problem that I have with a lot of the people that are coming into my office. They're being told the idea of genetics, chemical imbalance, here, take the drug, and no one's looking under the hood to say, hey, what may not be functioning well. And we also know that if you go back to there's a paper here I have called the RDoc, and this was published directly from the National Institutes of Health. And they basically said there's 5 areas of research we need to look at. Negative valence, like do you focus on negative things? By the way, this was put together by over 200 researchers from relevant fields. Number 2, positive valence, focusing on positive things. Cognitive, meaning paying attention to what's going on. Social, your interactions and who you're hanging around with. And then lastly, this thing called arousal. Arousal means the hypothalamus pituitary adrenal axis. It means looking at the brain more from a physiological point of view and saying what may be throwing that brain out of balance, and is the hypothalamus pituitary adrenal axis off, and then how could we address it from that point of view. And that's really where I've been able to jump in and help patients. If a counselor is needed, I refer you out. If someone's on medications, they're dealing with their doctor over there. We go after this from a very different point of view. Our results are pretty dramatic. It's rare, and I would say this, that within our success, 91% of our patients feel better in 2 to 4 weeks when they start to do what we're talking about. So we approach this from what's not letting the brain work properly. There's, potentially 47 different things that could be going wrong inside of someone. And from there, we try to identify what's not working well through proper testing, get a proper root functional cause diagnosis. We're not here treating a medical diagnosis. We're not treating anxiety, depression, and bipolar. We're treating the patient. And then from there, we set up a plan to fix what we find. And then you have real answers moving forward. What things did you find wrong, and what would you do to try to get the brain to work better? And in turn, that depression, anxiety, bipolar symptoms can many times get dramatically better or completely go away. So thank you. I hope you found this interesting. If you have any questions, please feel free to reach out.